Welcome, everyone. Thank you for joining us for this important discussion about navigating cancer care before and after diagnosis. I'm especially excited as it's Cancer Health Disparities Week, a time dedicated to identifying the disparities or differences that certain groups face when it comes to cancer and taking action to help them overcome them. MSK remains committed to reaching communities that have long faced barriers in accessing specialized cancer care. And during our time together today, we're going to talk about access to care, selecting a provider or care facility, ways to manage and cope with the concerns or fears associated with screening or a diagnosis, advocating for yourself and family members, communicating with your clinical team, and more importantly, resources and services available at MSK. But before we begin, I'd like to introduce myself and our panel of experts from MSK. I'm Julia Ramirez, Director of Patient Representatives, and in this role, I oversee the Patient Representative Department and delivery of patient advocacy services. I've also worked for almost 16 years in the immigrant health field and cancer disparities, bridging the needs of immigrant and underserved patients. This work is very dear and close to my heart, as I know how difficult it is for many patients to go through navigating the healthcare system and accessing care. I'm joined today by my colleague, Dr. Monique James. Dr. James is a psychiatrist who specializes in cancer care. She focuses on helping people cope with the physical and emotional challenges of cancer diagnosis, treatment, and recovery. In her outpatient clinic, Dr. James's area of expertise is in women's health and mental health, and also sees a variety of patients in the inpatient setting. Next, we have Kelly Turner, who's a Senior Director of the Patient Access Programs and leads the team that helps schedule and coordinates patients' first visit at MSK. Kelly has spent her entire career focusing on patient-centric operations and works to ensure a frictionless entry into MSK. She holds a master's in healthcare administration and a bachelor's in Spanish and health policy. And also joining us is Christine Wilkins, the Director of Social Work at Memorial Sloan Kettering Cancer Center. Prior to this, she served as the inaugural Advanced Care Planning Program Manager at the NYU Langone Health, where she developed an extensive program to enhance advanced care planning across the system as an integral component of quality patient care. She has over 20 years' experience helping children and adults cope with cancer and other health conditions. She is an active in national organizations supporting social work leadership in healthcare, advanced care planning, and social work group. Her interests also include clinical social work, trauma-informed care, bioethics, and promoting resilience for healthcare professionals. Thank you all for joining us today. I'm so excited to have this discussion with you. And I'd like to begin our discussion with Monique. Would you be able to help us understand what does health disparities mean, especially in cancer care?
Definitely. And Julia, thank you so much for that very warm introduction. And it's so lovely to see all of my colleagues here in one kind of place. And thank you all for joining on to this seminar right now. So first, just like, what is a healthcare disparity? So the American Cancer Society, it defines it as when the quality of healthcare differs between people, usually because of discrimination and based on several different kinds of factors. These factors include age, disability status, health insurance coverage, gender identity, geography where a person lives, income, race, ethnicity, or language. So all of these different kinds of things can lead to differences in how different patient populations are treated along the cancer care continuum and lead to a health disparity. You know, it could be in screening, it can be in diagnosis, outcomes, care and treatments, even in psychosocial stressors along the different kinds of timelines in cancer care, or even the quality of life after cancer treatment. And so, here at MSK, we're trying to work on this both on the provider side as well as the patient access side. On the provider side, definitely looking at our own biases. How do we see different patient populations? Really acknowledging it and changing it. We have quite a few groups working on it. Julia mentioned one, the Immigrant Health and Cancer Disparities Service, looking at differences with food and housing, financial care, language barriers, work-related concerns. We also have a global disparities group. We also have a large group looking at differences in research, clinical trials, how medicines affect different patient populations. And so when we're talking about access, we're talking about access to screening, access to prevention strategies, access to care, and how all of these different kinds of either lack of access or having access will then affect treatment outcomes. We're also looking at early screening versus late stage detection, right? So when we talk about cancer, most cancers are proliferation of a cell that's been mutated, right? It keeps on growing and growing and growing, and our body doesn't recognize that it should stop. And so early screening means that we can get the cancer cells in its smallest stage, usually. And usually in its smallest stage, that also means that we have more treatments, better access to even things like surgery and radiation, chemotherapies, and usually also a higher likelihood of survival. Unfortunately, late stage detection, which usually happens when people aren't able to get access to screening, unfortunately has later stage cancers, unfortunately a lot of higher rates of morbidity and mortality. So that's side effects and complications. And unfortunately, people who don't survive as much. So we're talking about a really big deal, right, with these healthcare disparities between patient populations. And so what we're trying to do is figure out where we can affect change along the cancer care continuum. Another thing I wanted to talk about is how sometimes disparities can even affect access to different kinds of treatments. So one thing that Memorial Sloan Kettering has always been a leader in is research and development of different kinds of cancer treatments and modalities. New treatments that affect the immune system, and new treatments that are now oral as opposed to through veins, right, through IV kind of systemic therapies. Even new treatment modalities in delivery of care, I like to say. So more regional sites, more local places where people in New York City and in the surrounding environments can come and get treatment. And so what about the difference between high risk and low risk populations? Sometimes I don't even like to say low risk. It's kind of high risk versus average risk in America, in New York. And so the high risk groups usually will have different kinds of factors that affect the different kinds of cancers that they get, whether it's late stage, early stage. So one of them is having a genetic predisposition. What does this mean? It means that some people's genes, some people's DNA, RNA, all of that good stuff that kind of make up all of our different tissues and our different bodily systems, some people will have a higher likelihood of developing cancer. But there are things that we can help to change, things like poverty, things like low consistency, to things like nutrition, healthcare, sick leave, health insurance, right? Marginalized housing, things like physical inactivity, things like diet, substance use, risky sexual activity, things like that. That we can actually affect change in. So I always say that a high-risk population doesn't have to stay a high-risk population if we also can kind of treat and also kind of target, some of these disparities here. And so, in my last kind of final points here, one thing I did want to talk about was stigma. Now, it is normal and typical and common, all of those words, to have concern about stigma, right? Stigma is understandable and it's a common concern. Unfortunately, it can be associated with secrecy, with self-blame, blame for another group, guilt, embarrassment. It's just this feeling of differing from the norm. And it's often also associated with the unknown, right? A group gets stigmatized or a thing gets stigmatized really because we don't have a lot of information about it. And sometimes, unfortunately, that stigma can continue on, right? No matter even if the knowledge comes to light and the actual stigmatized group or the reason why it is stigmatized is unfounded. And it can often also be associated with discrimination. When we talk about stigma in cancer care, it is a huge topic. And one of those reasons is that it has often been associated kind of directly and completely, unfortunately, with really bad outcomes, right? With people having a lot of complications, unfortunately, a lot of people passing away, a lot of treatments that haven't worked traditionally in the past. But these kinds of things are changing, right? How can we combat stigma? Well, one is to say no to misinformation. So all these kinds of things that we've heard, whether it's growing up, whether it's in different even news outlets and so forth, to really kind of make sure that we're getting good information. Another way is talking about it, right? Having seminars and conferences like this one. That's really the best way, I think. I think I might be biased as one of the psychiatrists, but really talking about it, getting our questions out, and really making it something that's less secret, less unknown, less kind of in the darkness, and bringing it out to light. And so the last thing I wanted to talk about is finding the right doctor or healthcare center, especially with something like cancer care, which is so important. The first thing is always to start with you. So go ahead and make a list of what's important for you and not your neighbor and not, the next town over, not even your spouse or your children or your mother, but what's important for you. For some people, that's going to be location. Some people, it's going to be making sure it's in network, access to trials, standard of care, psychosocial support. And once you meet your healthcare team, making sure that they listen to your concerns, they collaborate in decision making, they communicate well for you, have the best credentials, right? And in communicating with your healthcare team, it's okay to say, this is how I like to receive information. Also okay to ask, how should I communicate with you? And also okay to make lists of questions, right? Before and after appointments. I just did this with my mother the other day who had a minor procedure. And we sat down and made a list of questions to ask your surgeon before and afterwards. So you can get the right healthcare center, and you can also influence how you get information and communicate with your healthcare team.
Monique, I love so much of what you said, especially about the misinformation that's out there and how so many of our communities like hang on to this information as it's like, this is what it is, and I'm going to only go by this information. And I know that MSK has done such a wonderful job of like going out into the community, educating our communities, our most vulnerable communities about, making sure that they have the information they need in order to make, to come in for screenings, to ask the questions that they need to ask, especially, I think, not only our immigrant health program, but our Ralph Lauren Cancer Center, making that we're centered in Harlem, all of our regional sites, our MSK Direct program. And I think this is just, it's so important that, that we empower our patients to make sure that they have access to the information, but also empowering our patients to ask the questions, right? And make sure that they have the information they need when they need it the most, and access to the care that they need, which is nicely, cancer care is essential, right? And screenings and treatments can't wait. So I think it's a really nice segue, to have Kelly speak to us about the access to care, and our patients able to get appointments quickly, and talk about some of those misperceptions.
Yeah, so I believe that we have been trying tremendously hard to dispel some misconceptions about getting into MSK. And I have been in my role for just about 5.5 years and have really dedicated my team to be making sure that people feel like that when they call MSK, that they have access to get the questions that they want answered and answered in a timely fashion. And so it is a misconception that you need a referral to get into MSK. You do not need to know a specific doctor. In my own personal life, whenever I tell somebody I work at MSK, they say, oh, great, now we know somebody that's there that can help and get us in. And I'm like, yeah, you can call the 1-800 number because we take care of everyone equally. And so I think the most important thing to know is that we have appointments available as soon as tomorrow. We are in so many of regional locations and closer to community because I think absolutely patients' needs differ. And so we have people that are willing to come into New York City each and every day because that's what they did from a commute and that was super convenient for them. Or we have people that, really are putting location as their most important thing. And so I think what's great about the team in patient access service is it's a team of administrative professionals, nurses, and social work that really are committed to that first appointment and ensuring that this is the right next step for you. And it could be a conversation that is perhaps you want to stay local, but you have that family member that's really pushing you to get a second opinion and you're really comfortable with your doctor. And so you're calling us because your sister is telling you to call MSK, but you're not actually sure why you're calling us. That is a perfect example that my team is going to talk to you about. What are your concerns? What are you looking for? What could we help you with? What are questions that you feel like you aren't getting answered? And how could we help? And I think that that's really critical because we often hear from patients that I don't want to offend my local doctor, or I don't want someone to feel like that I don't trust them, but I just want to make sure that this is the right treatment for you. And I think what we have found is that a second opinion is just a second opinion if that's all you want it to be. And because cancer care is so, so critical and it is so life-changing, whatever you need to do as an individual or as a family or as a unit to be confident in your decision, you absolutely should pursue that path. And so our team is really there to help you understand if speed is your interest, how quickly can we get you seen by one of our doctors? If location is your driving factor, what location is going to be most convenient to you? If a physician or a clinical trial is of interest to you, those are all of the personalized recommendations that we can work with each individual on because it doesn't look the same for any individual. And I think that's really important to note.
Kelly, could you speak a little bit about to like what information is required?
Yeah.
Because I think a lot of patients want to know, well, how do I get in the door, regardless of, and I think that would be really helpful to
Sure, I would be happy to. And I think some of it is going to be very similar to other healthcare centers, and that, of course, there's going to be an exchange of demographics, insurance information. I think one piece that sets us apart and can sometimes feel like a barrier to patients in full transparency is this need to understand a little bit more in depth about your clinical situation. So you may call MSK and be told, oh, I want to request some records on you. And I want to talk a little bit about what that means, because I think in some ways it can feel like homework to a patient or a barrier that they need to overcome. But our team of physicians are subspecialized to the nth degree. And what I mean by that is that if you have a lymphoma diagnosis, lymphoma is a combination of many diseases. And so we want to make sure if it's a T-cell lymphoma, do we have the right lymphoma doctor that we can make available to you? If it's a mantle cell lymphoma, our physicians are so subspecialized, which allows them to really be experts in that field and ensure that they are at the cutting edge of knowing what clinical trial might be available. Where else should we be thinking about your family history as it relates to this disease? And so knowing that bit of information up front about your cancer history or what have you had worked up into this date really allows us to drive quicker to treatment or to options for you to think about because we've given you the right first visit with a subspecialized doctor that's going to be the most knowledgeable about your condition. And so we are always there to help with records. We will take on that burden for patients themselves. But I think it's really important that it is not meant to deter people from pursuing care at MSK, but rather it's to ensure that they get scheduled with a subspecialized physician that really is going to differentiate their care in this space.
That's really helpful. I think one of the other things, and just working in the community for as long as I've worked, and I know one of the things that we often heard were, just some of the challenges and barriers, and you spoke a little bit about that. But I was thinking more along some of like, perhaps it's some of the insurance challenges, and to speak to some of that, because I do think it's a reality, and for us to get your perspective.
It is a reality. And we are seeing, even in a post-pandemic world, especially when we were seeing job loss. And so perhaps people weren't employed at the same rate that they were, that commercial insurance wasn't as readily available. So it would not be transparent of us to not talk about that. Insurance can be a real barrier. And so MSK is in network with major commercial insurances, all commercial insurances. But the one place that we have been out of network with was insurances that were available on the exchange. But I will be so happy to report that as of this week, New York State has now written it into their New York State budget that any insurance company that is making plans available on the exchange for patient populations need to include NCI designated cancer centers as a place for care. And I know with my co-presenters, I think we are just all so excited and applaud New York State for allowing and bringing this to fruition, because this will really ensure that we do not see the disparities we see currently as it relates to where people can go for treatment when they are insured with some of these state-run programs. The kicker to this, though, is it doesn't go into effect till 2023, January 1. So we still do have the remainder of 2022, but that also should not lead for patients not to call us, because we have an excellent patient financial services team that works with all of our patients to best understand where is the right care for them. Our team is also super knowledgeable about quality care in the community too. And so calling MSK is also calling a strong education resource to best understand, if you're not in network, where should I proceed with care? And I think that that's also what is so valuable about calling the team that I lead, is that 30% of patients that call us don't end up scheduling with us. And that's okay, because that actually means that that wasn't the right choice for them. But we gave those patients and those family members the opportunity to think through what makes sense for their cancer care. And then they were able to be in control of that choice.
I think that's so wonderful. I think another thing I wanted to ask you is, now that we're seeing that we have more different populations coming into our center, and I think another one of the things I love about your team is that they do just the different languages, right? Like when they call. So I wanted to, if you could talk a little bit to that, and just the folk when they do call in, that there are individuals that can speak to them in their preferred language.
Sure. So yes, we do. We are available to speak in your preferred language. When it comes to the medical decision making and the terminology, we do tend to bring in an interpreter right on the phone with you, but it happens instantaneous in that same phone call, because we just want to make sure that our team is very conversational in the languages they speak. But we do think for the medical decision making, but we have that interpreter available. Like I said, it's not a different phone call. It's not scheduled at a different point. We do have a team through MSK Direct that I know that you mentioned that works closely with a lot of our union partners. And so that team actually has built-in Spanish speakers caregivers, because we knew that it's for a specific union partner, that Spanish language was going to be such a preference that we really wanted to make sure that we were meeting patients where they were in their preferred language. As you know, New York City, we have many, many, many languages. And so as the population changes, we are always looking to understand what is our staffing complement and how do we best represent the community to ensure that we are meeting the community where they are and not creating the stigma, again, back to Monique's conversation, that you need to behave or speak or know or have some certain levels in order to be treated or seen at MSK.
Thank you, Kelly. I think, it just really drives the point home that MSK has this team of experts that are here to help you, and, based on your needs. And I think, again, like the importance of all of us coming together, right, to help one another and support one another as our patients are coming through the door, which is a nice segue to once they get in the door, like the resources that are available to them to guide them once they're here. So I'd love to hear from Christine and just like what are some of the common concerns and issues that come up from our patients and caregivers.
Thank you so much. And it's so wonderful to be here with everybody and just to be hearing this amazing work that everybody is doing. We are collaborators with our patients first and foremost and with their caregivers. So we are part of one team. And so, it's not uncommon that when patients are initially diagnosed with cancer, that initial sort of feeling of heaviness, of not knowing what's going to happen, uncertainty, ambivalence perhaps, and fear, right, is often very real. They go through it, their caregivers go through it, their families, their friends. So it's something that sort of has many ripple effects too. Patients may ask themselves, will I be able to go back to work? And if I cannot go back to work, what is that going to mean to my family, our livelihood? And I think that, when we think about COVID and what we've all been through, this is all sort of made even more, it's all exacerbated. It's all made bigger because of all the different things everyone has been through. For those parents, what does this mean for my children? How will I speak to my children about what's going on? Are they going to notice? Are they going to, realize what might be going on? How is this going to impact them is often a question that parents ask. And for instances where a child is diagnosed with cancer, the parents are often also wondering, how will I tell my children? Should I tell my children, right? It's very normal for parents to want to protect their children. And so the inclination would be not to tell them. But one thing I learned early on in my time when I was working with children with cancer, I remember one oncologist saying to a family, telling them, honesty is our best policy here. And I remember that really stuck to me to this day, that often when we don't share, right, with a child what is going on, they're kind of suffering in silence because they're going through all these symptoms, they're going in for treatment, there's something clearly different going on for them. They may not be able to go to school sometimes because of the treatment they're receiving to make sure that they're protected. So I think that open communication can be so essential because otherwise people can end up suffering in silence. Other concerns that people do bring is, basically, how am I going to cope with this, right? Am I going to cope with this? So all of those questions are very normal. And this sort of feeling of shock, right, of numbness. Maybe I don't really even feel like I have any feelings right now because I don't really know what to feel. So all of that is absolutely very normal. There's no right or wrong feeling to have when one is diagnosed with cancer. All of those feelings, all of those reactions are absolutely normal.
So Christine, can you speak to a little bit about like what the resources are that are available for our patients and just when we should be reaching out to, to social work?
Absolutely. So social work care is an essential part of the team. So again, we are here for everyone. Um, we help with providing supportive counseling and with helping individuals cope with what is going on, whether it's the cancer diagnosis itself or whether it's the side effects of, for example, the treatment that they're receiving. So supportive counseling is a big thing. All of our social workers are trained, they're master levels trained, they're clinical social workers. So that is a big part of what they provide to really be able to accompany our patients through this journey, right, of cancer. We're also able to, we also have several support groups and group programs. They're all available on our website. We've got a very robust program in that area. Pretty much everything under the sun, whether the person is in treatment or whether it's for a caregiver, whether it's for bereavement support, whether it's about talking with children, all of those resources are also available. The pitch for group work, and for groups is it can be so therapeutic to hear other people or to be in an environment where you can hear others going through similar situations, and it's, you're perhaps not exactly in the same boat, but you're in the same sort of bigger ocean, and there's often it can be really helpful to see how other people are handling and coping with similar situations. We're also able to help with more tangible resources. So depending on the person's needs and depending on the person's income level and so on, we might also be able to help with some transportation needs, some assistance with regard to accessing care. Monique spoke earlier about health disparities, and we are very attentive to that if people at a baseline are struggling financially, we don't want that to get into the way of them not being able to make it to the appointment, not being able to make it in on time. We know too that with COVID, people have delayed certain appointments, and so we are very mindful of that, and we really try to help in that area. And then, things like we have food pantries here. I know Julia is our expert in the area. She helps start all of that. So I'm sure you'll be able to tell us more about that. But we try to really, again, make sure that having the cancer diagnosis is big enough in itself that we try to make it as easy as we can, both in terms of providing, again, the supportive counseling to help our clients feel empowered. So it's not only about doing for our patients, right? We want to help them, really promote their own resilience too, because everybody is incredibly resilient, right? When we think about it, people have a lot of inner strength. So it's not necessarily about doing things for others. It's really helping them also discover that inner strength that they have to be able to also, be able to cope with this overall. But we combine the two.
Yeah, I think in my previous work, working as part of immigrant health, but even now working in the patient rep department, I see the relationship with social work is so important as we're working together to make sure that we are addressing the psychosocial needs of our patients, but also addressing some of these other social needs that are so important while they're undergoing cancer treatment. We don't want any of our patients to ever worry about how to get to their appointments, where their next meal is going to come from. And I think to that point of I was very fortunate to be part of immigrant health for so long and be a part of that initiative of starting, such an easy concept, right? To start a food pantry for patients to access. But our patients are so grateful to have this resource. And I want to share a quick story of one of our patients that actually through all three groups, had we not collaborated, my group would have never known about this patient. And it was a woman who was diagnosed with metastatic breast cancer. She had three young children. And that day she was referred to us through psychiatry, and social work also knew her. And it was part of MSK Direct. So it all three came together. And I remember meeting with this this young woman in my office, and her sharing with me, had she not, you know, actually felt comfortable enough sharing that she didn't have food at home, right? And the embarrassment that she felt having to ask us for help. But she was also so grateful that she didn't have to worry about how she was going to feed her children that day, right? And I think that, I share that story because it's so valuable how we all have different strengths, right? And as I look at the four squares, but coming together, how strong we are together, right? And supporting one another, and all of that, to all of these four beautiful minds, right, to come together to help our patients. And I think about that all the time, how MSK is a very special place, and with very special people that want to help the community and want to do the best for our patients. So I think it's a nice segue to just talk about the importance of our patients speaking up, when sometimes patients and family members, feel they don't feel heard, or they feel dismissed, or they may feel embarrassed about, going against the grain or asking questions. But it is important that we empower our patients to just like be prepared. Write down those questions. You are your biggest advocate, and make sure that you're surrounding yourself also with individuals that can help guide you, and whether it's your family, family member, a friend, planning ahead. I think that it's so important, and I see it so much, especially overseeing the patient reps, and that you don't wait till it's too late, right? Until there's a crisis, that we have this more proactive approach of like trying to get ahead of it, and preparing yourself for that doctor's visit, like Monique shared, like helping her mom get that list of questions, and having those questions for when you go to your doctor's appointment. Oftentimes, I even dealing with my own family, like I know that they've gone to appointments, and then I ask them, well, what happened? I don't know, and so even telling them, bring a notebook, so that you can write down what was said to you, not being afraid to ask, and ask again if you didn't understand it. And I think, just some of the practical tips that I think about as I think about my own family, but also just all the interactions I have every day with our patients is, take responsibility, take control of your journey, right? And because speaking up can lead to positive change. And even if you have concerns or whatever concerns and feedback you have, we can use that to make sure that, we streamline a new process, or we help other patients, and you're helping other patients and other caregivers. So it's so important that you speak up. We can't plan for everything, but we can talk about what's most important to you. And that's really key, especially in healthcare. And we want to make sure that we know what's most important to you and what matters most to you. What else? I think I'm trying to keep track of the time as well. With all my friends here.
No, but I think if we have a second, I think one of the things that we learned, we didn't have a social worker that was embedded within Access. And too many times we would receive feedback from the clinical team that would come back and say, was there anything in the intake process that might have alerted us to this? And I think that those were really critical learnings for us to be able to understand that in order to start your cancer treatment and your cancer, your journey at MSK, it's not just about your oncology diagnosis. It is about you as a human being and taking care of you as a whole person. And so we introduced social work into the access process about 3 years ago to really ensure that those needs don't just appear when you have that new visit in a week. They are there and they are on your mind and you are thinking about them. And so by having social work be embedded within the access process, when you're on that phone call, we're able to start to set up what are those resources you may need. And I'm going to go back, Monique, you keep bringing me back to stigma. It is, I think people are afraid of that they don't want to be categorized as like a burden, or will I not get this treatment if they're afraid that I'm not going to be able to drive there? And so will this put me at a disadvantage? And so I think our teams work incredibly hard together to make sure that the opposite is what you feel, and that you feel supported, and that you feel that you not only are your own advocate, but you also have a team of people that are there for you to come up with solutions if you don't know what that solution needs to look like, or to help you think about what questions you may or may not want to ask. And I think also to give you the confidence that it's okay to have these conversations. And that's what I hope that we all walk away with, is that we should all feel confident to take control of these conversations and feel confident to return to activities like screenings, because that is so important to our care. And so whatever we can do to help restore that confidence so that people feel that they have the control that they need is really critical, I think, to all 4 of our areas.
Agreed. Monique, what are your final thoughts or insights before we end our session today?
Sure. It's just been such a pleasure to hear everyone's both specialties and also kind of concerns along this cancer care disparities. And, cancer care is essential care, right? Screenings and treatments, they can't wait. But I think the biggest takeaways for me are twofold. One is to say no to misinformation and miscommunication. So ask questions, talk about this. Let's reduce the stigma of cancer care and cancer care kind of along the continuum. Ask questions, speak to a trusted healthcare professional, and talk about the ways that you like to communicate with your healthcare team. And the other huge takeaway is that persons who are a part of high-risk groups can target risk factors to help decrease disparities. It's not that you have to stay in such the potential harm of a high-risk group. We at MSK are taking our role and responsibility as the provider aspect of that really quite seriously, and doing our part to help reducing some of these disparities. But the message is that you don't have to stay in the high-risk group.
Thank you, Monique. And Christine.
Thank you. So I think, probably the biggest takeaway for me is that you're not alone, that a cancer diagnosis doesn't mean that there's nothing to do. Actually, in this day and age, there's so much treatment that's available. But importantly, that we're all here with you. We're here as part of your team. And the question that comes up also, often is for family caregivers or friends of somebody diagnosed with cancer, how can I help? I don't want to upset them. Again, right, it's in social work, we have this sort of, concept that you start where the person is and you walk at their pace. And I think that for me holds true also when supporting somebody with a cancer diagnosis. Start where they are and walk at their pace. We're all very different human beings, right? For somebody, talking about it might be helpful. For some others, giving them this space would be important. And then the other question that sort of comes up a lot is, how do I provide help? How do I support that person? Sometimes just saying, call me if I can do anything could be the only thing you can say, but sometimes that's not actually very helpful because people often have a hard time asking for help. So maybe instead of saying, I know you must be going through a lot right now. why don't us friends and family take it in turns to cook meals for you and your family, right? So plan out the month, right? And so that's one less thing they have to worry about. Why don't I pick up your kids from school? I can easily do that. Why something on my own, right? So these are sometimes concrete ways of helping support that individual that just make it easier. Sometimes the whole process of asking for help can be a chore in itself, and that sometimes is a bit too much to have to handle. So those are just some ways. And then, of course, as social workers, we also really emphasize the importance of how you have coped until now, what has been helpful, whether it's your faith, your spiritual beliefs. What are the kind of things that you have been using up to now that might also be used in this journey? Thank you.
Well, thank you all so much. I feel so honored and privileged to have spent the last, hour with the three of you. And I think the message that definitely came through is that you're not alone. You're not alone in this. And we at MSK have resources for you to help you, and experts that can help guide you and connect you to the right individuals to make sure that you get the services and care that you need. And so don't be nervous to reach out to us. We're here. And I just want to thank all of you for joining us. This was such a wonderful, rich discussion. And certainly we're really grateful that you joined us this afternoon. Thank you so much. And we'll be posting, they're recording it. So if certainly we'll be able to share it with other colleagues and friends.